Hello, Miss Garcia. Hi, Kylie. My name is Devin, and I'm going to be your nurse today. I'm going to be performing an assessment of thorax and lungs, cardiovascular, peripheral vascular, abdominal, and possibly neuro today. So, do I have your consent to do an assessment on your child and to film this video?
Yes, you do.
Thank you. Okay, so I'm going to first start by identifying some landmarks on Kylie. I have already washed my hands. I have provided for privacy. I have gathered my equipment right here. And I'm ready to start running the trachea. The trachea right here is midline. I'm going to come right here. This is the suprasternal notch. And then right here is the angle of Louis. And then right here you come to the side. This is the second rib. Right here you have a clavicle. So this is mid-clavicular line. And then you have, I'm going to just lift your arm right here. You have your mid-axillary. You have your anterior and your posterior axillary lines. And then I'm going to turn you around right here. Move your hair. We have your scapular lines, and then we have your vertebral line. Okay, so, and then we're going to find our lung fields. On the back here, we have the upper and the lower. And right here, we also have the upper and the lower. And then we come back to the front and turn back around. On the left side, we have an upper and a lower. On the right side, we have an upper, a middle, and a lower. Okay, I'm going to start by inspecting your thorax. Right now, everything is symmetrical. The chest is symmetrical. She's in an upright position while breathing. There's no tripod position. Breathing is unlabored. Now I'm going to check the angle of your ribs, so I'm just going to come down here. I'm going to have you take a deep breath for me, okay? Okay. Symmetrical. And I'm going to check back here for the angle of your ribs. I'm going to have you take another deep breath, okay? One more. Okay. So in the front, it was symmetrical expansion. In the front, it was 90 degrees, and in the back, it was also symmetrical expansion, and it was 45 degrees. Her neck and trapezius muscles, there's no overextension or overexertion from breathing. Your skin color is appropriate for your ethnicity. It's even throughout. There's no signs of cyanosis. Your level of consciousness is good. You're responding to commands. Facial expression is calm with no signs of labored breathing or any trouble or difficulties getting oxygen. Okay, so I'm going to do my test for tactile pheresis on the anterior portion of the chest. So I'm going to have you say 99, okay? So go.
99. 99.
Say it again.
99. 99. 99.
Okay, now I'm going to come to the back and turn you around. And move your hair. Okay, and have you say 99?
99. 99. 99. 99. 99. 99.
Okay. Okay, so now I'm going to start on my percussion of the posterior chest wall. Come to this side. Okay. I'm going to turn you around so I can do start right here. And come down here. Okay, so we're going to position you on the couch so you're at a 30 to 40 degree angle so I can start my auscultation and listen to your breath sounds. First, I'm going to clean my stethoscope. Okay, I'm going to start off by listening to your front chest, okay? So I'm going to have you take deep breaths every time I move, all right? Okay. Take a deep breath. Big deep breath. Big deep breath. Big deep breath. Big deep breath. Okay, the front was clear to auscultation bilaterally. Okay, now I'm going to cover you with the blanket to provide for privacy. But first we're going to have you sit up so I could get the back portion. And listen to your lung sounds in the back. I'm going to have you take a big deep breath, okay? You sit up for me, a big deep breath. Big deep breath. Okay. Lung sounds were clear to auscultation. I didn't hear any crackles or wheezes or any abnormal sounds. Okay, now I'm going to listen to your voice sounds. So right now I'm going to have you say 99 whenever I move to each location, okay?
Okay. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99.
Okay, now you're going to say E.
E. E. E. E. E. E. E. E. E. E.
Okay, now you're going to whisper 1, 2, 3, okay? '99 was muffled as well as the E. I didn't hear any abnormal sounds. It didn't sound like eh. And the whispered 1, 2, 3 was barely audible. Test for diaphragmatic excursion. So I'm going to have you take a big deep breath, let it out, and then you're going to hold it, okay? I'm going to lift your shirt, all right? Okay, big deep breath. Okay, you can breathe. I'm just going to put some tape on your back, okay? Just a little piece. Okay. Now I'm going to have you take a deep breath and hold it, okay? Okay, you can breathe now. Okay, so now I'm going to do the next slide. I'm going to have you take a big deep breath and let it all the way out, okay? Okay, you can breathe. Just going to mark it on this side. Right there. Okay, now I'm gonna have you take a big deep breath and hold it for me. Okay. Here. And now I'm gonna measure. And I'm gonna have 2. Okay. Now I'm gonna measure this side, and this side is 2. Okay. Now I'm gonna take the tape off. Both sides were 2 centimeters, and that concludes the lungs and thorax. Now we're going to move on to our cardiac assessment. Now we're going to begin our cardiac assessment. So first I'm going to begin by assessing for jugular venous distension. So first I'm going to palpate and see if I can feel anything. And then I'm going to come over here and I'm going to put my measuring tape right at the angle of Louis. I'm going to put it right there, and then I'm going to put my straight edge and just measure to see where I can feel. And that is about 1 centimeter right there. Okay, so next I'm gonna come over here and I'm gonna look for any movement or any pulsing. I don't see any abnormalities, I just see normal breathing. Okay, now I'm going to feel for the carotid arteries, so I'm just going to come right here and I'm going to do one at a time to make sure. Okay, I felt that one. Normal rate and rhythm. Now I'm going to come over here. Normal rate and rhythm, strong, 2+. Okay, now I'm going to assess your apical pulse, so I'm going to just uncover you a bit right here. Let me grab my stethoscope, and it is clean because it is the same patient, so I'm just going to use it. It's a little cold, so I'm going to warm it up a little bit. I'm just going to come right here to the apex. Okay, a normal rate and a normal rhythm. I'm just going to go ahead and count for 30 seconds, the apical pulse. Okay. I counted for 30 seconds and I got 44, so multiply that by 2. That is 88 beats per minute as the apical pulse. Now I'm going to auscultate for the 5 cardiac areas. I'm going to start with your aortic. So I'm going to come right here, and it's warm, so I'm just going to listen, okay? Your pulmonic. I'm going to come down to your second pulmonic, so I'm just going to come right here. Okay, now I'm going to lift your shirt. Now I'm going to get to the tricuspid area, which is right about here. Come right here to the mitral area. Okay. The rate and the rhythm were both regular. S1 was louder than S2 at the apex, and S2 was louder at the base. And now I'm going to check for a carotid grooving. So I'm going to have you hold your breath, take a deep breath, and hold it for me while I check for this. Okay, now breathe. Now take another deep breath for me. Okay, now breathe. I didn't hear any bruise, any abnormal sounds. Everything was good, and that concludes my cardiac assessment. Now we're going to begin our peripheral vascular assessment. I'm going to start by inspecting your arms. I'm going to check for your color. Color is appropriate for ethnicity. It is evenly distributed. Hair is evenly distributed. No patches. A couple of tiny cuts. And check your legs for color. Color's even. A couple of cuts. Hair is evenly distributed. I'm just going to check your temperature of your arms. You're warm. Check your legs. You're warm evenly throughout. I don't see any edema present in your arms. Okay. Right here on your calves, there are small veins, but other than that, I don't see any visible varicosities or any other varicose veins. Okay, I'm going to come up here and I'm going to check your skin turgor. Check your hand. I'm sorry. Okay, you're going to feel a little pinch again, okay? Right there, and then you're going to feel a little pinch on this side. I'm just going to check all the way up. Okay, I'm going to check right here, alright? Okay, your skin turgor is good, which means that you are very hydrated and I don't see any tenting or anything. I'm going to come down here. Are you ready?
Yeah.
I'm going to come down here. Do you feel any pain or tenderness when I do this?
No.
Okay, what about on this side? Any pain or tenderness?
No.
Okay, now I'm going to measure at the widest part of your calves. And it is 14 1/4. And I'm gonna measure this side. And this side is, just gonna move your leg real quick. Fourteen 1/4. So they're the same, which is a normal finding. Now I'm gonna come back up here. And can I see your nails real quick? I'm just gonna check for capillary refill in your nails. So okay, I'm gonna check this side. And it is within a second, which is normal. Now I'm going to check your toes, your capillary refill. Oh, before I do that, I'm going to check for clubbing on your fingers. So can you do this with each of your fingers? Put them together so I can see. Here, like this. With one of them. Okay. So these ones close together. Okay. I'm going to do that one. There's no clubbing there. And this one. No clubbing. No clubbing. And Now fluttering, each of them is less than 160 degrees. Now I'm going to come down here to your toes and check capillary refill on your toes.
Ew.
Okay, and it is less than a second. For each of your toes. And okay, now I'm going to check your pulses. First, I'm going to check your radial and your ulnar pulse. So I'm going to check your ulnar pulse right here. Strong 2+, rate is regular, rhythm is regular. Radial pulse is strong 2+, rate is regular and rhythm is regular. I'm going to check your brachial pulse. Okay, I'm going to check them both for both sides, so I'm going to come back over here. Check radial. They're equal bilaterally. Ulnar. Equal. Brachial. They are equal bilaterally. Okay, now I'm gonna do the Allen's test, so can I see your hand, please? Okay. Now I'm going to cover both of your pulses, and whenever I do that, I'm gonna have you squeeze your hand like this, okay? Whenever I have them covered. Okay, now I'm gonna uncover, squeeze it more, and faster. Open and close it really fast. Okay, now I'm gonna uncover this one. And color is returning, and I'm gonna uncover this one and squeeze it really fast like that. Okay, and color is returning. Now I'm gonna come over. Okay, the femoral pulses are up here. I'm not gonna do those, so right now I'm gonna feel the popliteal pulse. This one is palpable, rate and rhythm is regular. This one. It's also palpable, rate and rhythm is also regular. Now I'm going to come down here and feel the dorsalis pedis. It's palpable, rate and rhythm is regular. And now I'm going to feel the posterior tibial. It is palpable and rate and rhythm is regular. Okay, now I'm going to feel for the epitrochlear node, so I'm just going to shake your hand right here. And then get it, and I'm going to shake your hand. And I'm just going to feel for any nodes right here. And I don't feel any palpable nodes. I'm going to check for the epitrochlear nodes on this side, so I'm just going to shake your arm out. I'm going to feel it. And I don't feel any palpable nodes right here. No palpable nodes. Okay, now we're going to do our assessment of the abdomen. I'm going to have you laying down flat. We're going to change the order of things. So first I'm going to inspect, and then I'm going to auscultate, and I'm going to percuss, and then I'm going to palpate. So I'm going to start by uncovering you up to right here. And I'm just going to inspect. The symmetry, everything's symmetrical. Skin color, everything is even throughout. The umbilicus is midline. There's no striae lesions. No piercings are present. Now I'm just going to get even. There's no abnormal pulsations or movements. Breathing is normal. Okay. Let me see right here. No abnormal pulsations. I don't see anything. Okay, now I'm going to auscultate for bowel sounds. They're clear. They're clean already because this is the same patient. So I'm gonna start, and it's warmed up already. I'm gonna start in the right lower quadrant. Move up to the right upper quadrant. And the left lower quadrant. Okay. I didn't hear any abnormal sounds. There were equal vowel sounds bilaterally, gurgles. I didn't hear any bruits at all. Now I'm going to check in all 4 quadrants for tympani, and I'm going to press. Okay, tympani is heard. I'm going to check right here for your liver span, so I'm just going to check to where it changes to dullness. Okay, that right there, so I'm just right there. So I'm just going to tape it right there. And then okay, and I'm just gonna tape right there. Okay, and now I'm gonna measure. Measure it, and it is 6.5 centimeters. Okay, and now I'm going to palpate over here on this side for some dullness. So I'm just gonna sure it's dull. It's a dull sound. No palpable masses. Sound is dull. Okay. Okay, now I'm gonna start with light palpation. I'm gonna start in the right lower quadrant and tell me if you feel any pain or any tenderness, okay? Come to this side. Any pain or tenderness at all? It's just an uncomfortable feeling. Okay, now I'm gonna go ahead and do deep palpation, starting in the right lower quadrant. Tell me if you feel any pain or any tenderness, okay? Okay. No pain or tenderness? Okay. Now I am gonna check I'm gonna palpate your liver. So I'm gonna have you take a big deep breath and then you're gonna let it out from me, okay? You're gonna let it all out, okay? Ready? Big deep breath. Now let it all out. I can barely feel it, which is normal. So there's no liver enlargement. Okay, you can your spleen right here. And I don't feel it. I don't feel any abnormalities. It's not enlarged. Okay, now I'm gonna pull your shirt out. And I'm just gonna have you sit up for me. Okay. And we're gonna have you turn this way for me. Facing the back. Okay, and I'm just gonna put your hair on this side. I'm gonna put my hand on the costal vertebral angle and tell me if you feel any sharpness or any pain or anything, okay? Any pain, any sharpness? Okay, now this side. Any pain, any sharpness? Okay, and that concludes our abdominal assessment.